At 10, call it the COVID comeback. And if you or your friends and family have come down with COVID-19 this summer, you already know there has been an uptick. FOX-11's Laura Diaz here in studio with details. Laura.
Yes, Alex, here we go again. School is back in session. People are being told to spend more time in the office, and COVID is spreading again. Help is on the way, but that's not much comfort if you're suffering.
I have a fever, very high fever, maybe 102. And I have whole my body was aching, and my legs, I can't even feel my legs. It was very painful at nighttime.
That's Lolita describing what it felt like to get COVID for the first time a few weeks ago. She took Paxlovid and isolated from her husband. And she's not alone. Chances are you know someone yourself. As of last week, LA County reports 330 people hospitalized with COVID. According to the county health department, that's a 49% increase from 4 weeks ago. As an owner of a hair salon, Lolita put the needs of her clients on hold until she was healthy again. Armed with a negative test, she's now back at work.
I want to say thank you to all my customers, because my customers been with me for 27 years, and I have to reschedule all my clients.
Stories of people getting COVID this August after a relative lull in cases is no surprise to this infectious disease physician.
Whenever there is an uptick, it means that the virus is replicating robustly.
There's a rhythm to when people get COVID. A new variant has become dominant across the country, including California. It's called EG5. And as people travel, have a waning immunity, and take fewer precautions, there's been an uptick in COVID this month.
As they progress, they learn how to evade immunity. So people who had COVID before, people who were vaccinated before, are the ones who are likely to get infected, because typically most of us think, oh, I had COVID, I should be okay. No, you're not. You do not want mutations. You do not want to see these upticks.
And speaking of waning immunity, when is the next vaccine available? The doctor tells FOX-11 the newest COVID vaccine is not ready yet. It's hard to say exactly when we will roll up our sleeves again for a shot, but likely later in the fall. But it looks like people will be getting 2 shots, not 1.
I don't foresee the new vaccine that is being worked on right now for the XBB variant will be available as a combo for the influenza vaccine.
So that means you'll also have to get the flu vaccine. As far as tips to protect against COVID, they'll sound remarkably familiar. The doctor says she still uses the 6 feet apart rule when in crowded places like the grocery store. And don't be afraid to mask up, especially if you're not feeling well.